let's have a look at where racial division and the implementation of racial privilege for some gets a nation. We don't have to look far. Over in New Zealand, they're giving us a real-world preview of what we can expect if we go down this ill-advised path. Yes, New Zealand's embrace of New Age apartheid is going as well as you would expect. The latest race division is, well, this once harmonious country sees medical professionals being advised to consider whether the patient is Maori or Pacific Islander when determining if they'll receive priority care. The New Zealand Herald reports Auckland surgeons are now required to consider a patient's ethnicity alongside other factors when deciding who should get an operation first. Several surgeons say they are upset by the policy, which was introduced in Auckland in February and gave priority to Maori and Pacific Island patients on the grounds that they have historically had unequal access to healthcare. But the racially charged environment in the country sees medical professionals reluctant to speak on the record against these racist policies. Several have spoken to media on condition of anonymity, with one surgeon calling the new measures indefensible and another saying they were disgusted by the racial rankings. It's ethically challenging to treat anyone based on race. It's their medical condition that must establish the urgency of the treatment, the surgeon told the New Zealand Herald. He continued, there's no place for elitism in medicine, and the medical fraternity in this country is disturbed by these developments. But the Health Minister, Aisha Verrall, is unapologetic about giving certain ethnicities priority care. She said the reformed health system seeks to address inequities for Maori and Pacific Islanders, who historically have a lower life expectancy and poor health outcomes. Perhaps one of the reasons why certain communities have poor health outcomes is due to the fact that they have enormous rates of obesity and morbid obesity. According to New Zealand Ministry of Health, 71.3% of Pacific and 50.8% of Maori adults are obese. Now compare that to 31.9% of Europeans and 18.5% of Asian adults. But of course, tackling that issue may be deemed racially insensitive, or you may be accused of fat shaming. So instead, Te Wata Ora, that's the public health agency that last year replaced district health boards across New Zealand, well, they're giving advice to medical professionals that waiting times and priority medical care should differ according to racial categories. Now, you can call this reverse discrimination, you can call it affirmative action, you can even call it equity, but it's just racism, plain and simple.